what is congenital spinal stenosis and what you need to know when you have it and how rare is it? So let's get into it. So congenital spinal stenosis means that you are born or a person is born with a naturally narrow spinal canal, and that's for cervical and for lumbar. So unlike acquired, just normal spinal stenosis, this is something you're actually born with. So it's something that is present as you are a newborn. But the types of acquired spinal stenosis is normally due to wear and tear when you're just getting older. You picked up something wrong and you got a disc herniation or an injury from a car accident or from you playing sports. But congenital spinal stenosis, whether lumbar or cervical, is due to short pedicles, usually ligaments or different bone structures that will cause narrowing. So, how rare is congenital spinal stenosis? Well, it's very different because studies show that only 2% of the population suffers from congenital lumbar spinal stenosis. So, when you think of it on that scale, you could see that that's only two in every 100 people. So it's extremely rare to be born with such a disorder, but it does happen. So let's look at it from another point of view. Let's think about cervical, because for cervical congenital spinal stenosis, there is less of a rarity and more of a difference in demographics. So there is an issue where it's more prevalent. So congenital cervical spinal stenosis is more common in Blacks, Asians, and Hispanics than it is with whites, where there's a 39% in Blacks, 33 in Asians, and 22% in Hispanics at birth. And what causes them again is the short pedicles, thickened ligaments, and some facet joints that are probably a little brittle at birth. And these are normally the typical ones, but the majority of it is from short pedicles. And these are bony structures that are too small to provide enough space for the spinal cord, and it naturally reduces the spinal canal and it starts nerve compression at an early age. And this is something that you would feel right away. So if you want to know what those signs are, just keep watching because the signs are different, but you have pain, numbness, tingling, and it could be in any of the limbs. And there's weakness and difficulty walking and a loss of balance and coordination. And that's because it can be for cervical or for the lumbar. But it depends on how pinched the nerves are from your spinal canal getting smaller and smaller. So it gets worse based on that. Some people don't have extreme conditions and other people do. And some people lose their mobility, like I did. So, when do the symptoms appear? This is something that you have to be honest with yourself and a doctor because while congenital stenosis is present at birth, symptoms don't show up and it doesn't come until you're an adult. However, 35% of teenagers experienced it as young as 15 years old. And I have a whole story about that myself, and I'll tell you later. However, others don't experience it until they're in their 30s or 40s. And this is when natural deterioration starts, but we're already in a bad place, so it impacts us a little bit quicker. So how does doctors know you have it? So this is where the right help comes in. First, a reflex test can be done by any doctor, your primary care doctor, orthopedic doctor, it doesn't matter. This is where you want to start at first, and they evaluate the nerves. And then from there, they go and get an x-ray to see if you have a smaller or narrow canal, but there's nothing else that can be seen. However, if they want to see if there's more, they can order a CT scan where you can see blood vessels and more detail of the bones for any deterioration. But doctors must have an MRI in order to see congenital spinal stenosis. It shows the nerve compressions and your canal at the same time. So the doctors, after your primary care doctor, an orthopedic doctor, a neurologist, and a physical therapist are your primary care group. And that's something you want to pay attention to. So, what can you do at home when you have congenital spinal stenosis, whether it's cervical or lumbar? For us with it, I have it, and for me, it's all about the posture. You have to sit up straight. You want to make sure that everything is good. It just reduces pressure off of your spine overall. And since for me, in my case, and the other 2%, um, excess weight adds pressure to the spine, and which is why my pregnancy was so hard because it was on the lumbar. But swimming, walking, and using a recumbent bike is great. As you can see, her hands are placed forward, as this is something that you can hold on to while still doing it, even if it's cervical. And speaking of exercise, keep physical therapy always nearby because they're going to show you how to live and have a better quality of life and they stabilize your spine for every part of it. If your mobility is affected, like from the lumbar or from your arms, you can try to get on a diet so that they can give you immune efficient foods to build up strength in your body, like proteins that you need, because pain can interfere and make them very difficult to do if you go to physical therapy. So, pain management can help you with your quality of life. And some ways to help with that is anti-inflammatory. This can be in the form of food or Advil that can stop swelling in those places. You can use muscle relaxants, and that has to be given to you by a doctor, or you can go through with having injections like I did so that I can be able to move around. If the symptoms affect your mobility, cause nerve damage, or it does not improve with therapy, please seek medical advice from an orthopedic surgeon or a neurosurgeon because they would see how bad it is for you. Because surgery is for severe cases where nerve compression significantly impacts the mobility and quality of life. And this is usually a laminectomy and then a fusion. So the thing is, get seen as soon as possible. I hope you like this and please like, comment, and subscribe, and I hope to see you soon. Bye.